actually do think that there's nothing more powerful than sitting at a patient's bedside and holding their hand. If it goes back to that uh, concept of making them feel better. And certainly, I think you've had several kids that you've taken care of. You're struggling. And I remember a story you told me on the squash court a few years ago where you were able to do a procedure on this young kid without much anesthesia, that you were just essentially comforting them and holding their hand. And that to me is a very, very powerful emotion and scientifically valid too, right? Like, I mean, pain pathways and comfort pathways work through the same brain receptors at some level.
I'll just share briefly with the audience. I had a very similar experience. You mentioned holding someone's hand, and that struck me because I made a diagnosis of leukemia in a child, a very severe form of leukemia, where a child presents with a very high white blood cell count. And the diagnosis itself was not difficult to make based upon the child's presentation. However, when I had to give the family news, they asked me to pray with them. And as a nice Jewish boy, I typically, this is not something we normally do in that moment. And they asked me to um, kneel down in this quiet room, and we all held hands. And there was a chaplain there, and there were some things that were said, and we were in a small circle, and it was one of the most powerful experiences I've had in my career. And when I look back at it, being there with the family and having them invite me into their prayer circle was way more important than actually making the diagnosis. Obviously, making the diagnosis set that up, but it was actually the engagement with the family that was the most meaningful thing to me, and continues to drive me in the last third of my career towards continuing to practice clinical medicine, because it is those patient encounters and those patient experiences that are beautiful. And the story that you told is such a beautiful story, especially considering, and interesting, considering his age and